Welcome to the Mortuary Masterclass, brought to you by the Champion Company, where preservation meets purpose, and every step is part of your journey to safer solutions. In this episode, we'll be diving into a discussion on dehydration in embalming, causes, effects, and solutions, exploring the challenges embalmers face before, during, and after the process, and the proven steps to control it at every stage. Dehydration. It's one of those age-old problems that has been frustrating embalmers since the very beginning of this profession. We've all seen it: tight, dry skin, wrinkled tissue, that rock-hard rigidity that for years many considered a sign of good embalming. But let's be honest, most of those are just signs of moisture loss, not necessarily proof of better preservation. The real cause? It doesn't happen at just one point. It can strike at three stages before embalming ever begins, during the embalming itself, and even afterward once the work is done. At Champion, we've built a deep foundation of field research and real-world testing to better understand the causes of dehydration and evaluate which solutions truly work in the prep room. In this episode, we'll break down those findings in a practical way, equipping you with proven techniques to manage and prevent dehydration in your day-to-day embalming cases. Dehydration typically appears during one of three stages: before embalming, as a result of the embalming process itself, or after embalming. Each stage comes with its own causes, effects, and best practices for prevention or correction. We'll explore all three phases individually, sharing targeted strategies to help you handle each one with greater confidence and control. Phase 1. Pre-embalming. Dehydration can begin long before a body ever reaches the mortuary. The cause of death, the dying process, and the medical treatments administered beforehand often leave the embalmer facing significant fluid loss from the outset. Cases involving elderly, bedridden, or critically ill individuals are especially prone to this. Limited fluid intake, fever, diuresis, and prolonged IV medications all contribute to severe pre-embalming dehydration. Noting that elevated body temperature, antibiotic therapy, and oxygen use, common in end-of-life care, further accelerate fluid loss. Certain medications, particularly cardiac drugs with diuretic effects, worsen dehydration after death. Likewise, chemotherapy and radiation treatments can disrupt the body's fluid and electrolyte balance, leaving tissues highly compromised. While these conditions are beyond the embalmer's control, they represent the first phase of the dehydration challenge that must be addressed in the prep room. All of those conditions pull fluids out of the body, leaving tissues dry and fragile before we even begin. And then there's refrigeration. While common practice, it can be tough on the body, especially when it comes to dehydration. Morgue coolers push a lot of air, and if the body isn't fully covered, that airflow speeds up drying. Even with a cover, moisture is still pulled from the skin. And if that cover is an absorptive sheet instead of plastic or another moisture-proof material, it can act like a wick, drawing even more moisture out. Delayed or postponed embalming also adds to the issue. Every hour embalming is postponed, more moisture is lost, and more work is needed to adequately preserve, restore, and sanitize the body. And sometimes we make dehydration worse without realizing it. Swabbing the mouth, nose, ears, or eyes with concentrated formaldehyde or cavity chemicals can quickly dry out those tissues, hurting the natural look we're aiming for. High alcohol sprays aren't much better. They offer little real disinfection and speed up drying. A better approach? Water-based sprays with fast-acting disinfectants are safer and far more effective for sanitizing orifices and body surfaces without stripping moisture from the tissue. When setting features before embalming, skip the cotton in the facial orifices. Cotton pulls moisture from the mucous membranes and skin, causing noticeable dehydration. A better choice is embalmer's putty. Just make sure it's a modern, cartridge-loaded type with moisturizing properties like our Champion putty. Older mastics were hard to work with, had no humectants, and sometimes even contained formaldehyde, drying tissues even more as they hardened. Remember, any product that dries and hardens will draw moisture from delicate facial tissues. If cotton is your only option, At least saturate it with a liquid humectant to reduce the wicking effect. For general cleansing before and during embalming, reach for an emollient-based disinfecting soap, like our surgical soap, made specifically for our work. It cleans effectively without stripping moisture, unlike harsher general-purpose cleaners that dry tissues and hurt the cosmetic result. Skip the bleach too. It's harsh, speeds up dehydration, doesn't mix well with formaldehyde, and in the diluted form most embalmers use, it's overrated as a disinfectant and adds exposure risks. Today's embalming-specific disinfectants do the job better without those downsides. And before shaving, protect the skin with a moisturizing treatment. Our Chemco cream is perfect for this. It prevents razor burn, keeps facial tissue supple, and helps avoid unsightly tissue damage. Aloe-based or other humectant creams can work too, but make sure whatever you use locks in moisture. Phase 2, dehydration caused by embalming. Here's the big one. Most dehydration is caused by embalming itself. For decades, we've associated tight, rigid, leathery results with good embalming. But those are just byproducts of drying out, not proof of deep preservation. Instead of relying on harsh, high-index solutions, switch to buffered, controlled arterial fluids, or glutaraldehyde-based and glutaraldehyde/formaldehyde combination fluids. These react slower, penetrate deeper, and achieve full preservation without the excessive drying. Do you need extra strength? Add glutaraldehyde-based boosters. They enhance preservation without tipping the balance toward dehydration. Co-injectant buffering agents are also key. They moderate the aggressive action of formaldehyde, making results more natural and consistent. Humectants play a big role here too. Aloe-based humectants, like Champion's own humectant aloe factor, are especially effective. Aloe carries a large water load in a small molecular package. It penetrates tissue easily, won't clog capillaries, and helps maintain moisture throughout the body. Lanolin and older cellulose-based humectants work, but aloe's solubility and penetration make it far more effective. And here's an important timing tip. Always add humectants at the start of injection, not just in the final gallon. Starting early maximizes moisture retention and produces softer, more natural tissues overall. Cavity treatment can also lead to unwanted dehydration. Using harsh, high-index formaldehyde cavity fluids, especially in large amounts and injected into the upper chest or neck, can cause browning and drying of delicate lip and facial tissues. Drying cavity chemicals high in alcohol make this even worse. They don't improve preservation results, just dehydration. Plus, stronger fumes mean more formaldehyde exposure without real benefit. A better choice? Low-fuming, multi-base cavity chemicals like our Dicav 45 or GX Cavity. They combine glutaraldehyde and other aldehydes to deliver strong preservation while reducing exposure hazards. And when used properly, they help avoid unnecessary drying of sensitive tissues. Lastly, there is phase 3, or post-embalming, where even with perfect embalming, dehydration can still creep in during aftercare. Before you dress or cosmetize, give all viewable areas a quick mist with a spray emollient, or smooth on a high-grade aloe or water-based massage cream. Now, massage creams do the job, but sprays? They apply evenly, won't clog pores, and there's no need to wipe them away before cosmetics. That's why embalmers can't get enough of our Skin Tone Plus. And here's the pro tip. Skip the Vaseline and petroleum-based barriers. Sure, they look protective, but over time, those volatile carriers actually pull moisture out of tissue. For any areas that need a little extra love, go with concentrated aloe humectant packs or another moisture-locking additive. And always cover the remains with plastic sheeting between embalming and dressing. Steer clear of cotton sheets or anything absorbent. They'll wick away moisture and dry the tissue faster. Check your environment too. Redirect heating or AC vents so they're not blowing directly on the body, because even the smallest breeze can undo all your good work. When it's time for cosmetics, reach for aloe-based, water-soluble makeup. It blends beautifully, keeps tissues flexible, and gives that soft, lifelike look families love. And here's a big no-no: ditch the old grease paint theatrical makeup. It dries out tissue, needs harsh solvents to remove, and leaves an artificial finish. If you've used a topical gel or pack on sensitive or visible areas, remove it, clean gently, and then reapply a moisturizing spray or concentrated humectant before adding humectant-based cosmetics. To help control dehydration between visitations, cover the face and hands with plastic. If burial or cremation is delayed, keep those key areas covered and the casket closed, but not sealed. Check regularly for any signs of drying and reapply a humectant-based product as needed to keep tissues looking fresh. The bottom line: Champion's field research proves it. Follow these steps and you can reduce or even eliminate dehydration issues in over 75% of cases. But here's the real takeaway: most dehydration problems aren't from the body's condition. They're caused or made worse by the products we choose and the little preventative steps we skip. So update your methods. Choose fluids that hydrate, add humectants early, protect the body after prep, and say goodbye to outdated practices. Do that, and you'll deliver viewable, lifelike results that families notice and truly appreciate. Thanks for tuning into this special edition of the Mortuary Masterclass. Until next time, keep doing what you do best, championing the prep room with purpose, because embalmers matter, and every step forward is part of your journey to safer solutions. That's the champion difference.